Hello everyone, my name is Uyi. Welcome to DocMed. Today's topic is on sleep apnea. Many people see snoring as something to be embarrassed about or something to joke with, but the fact is, snoring can be a symptom of a very common and potentially serious sleep condition known as sleep apnea. Sleep apnea is a condition whereby the person's breathing is interrupted when they are sleeping. People with untreated sleep apnea actually stop breathing numerous times while they are sleeping. This causes low blood oxygen levels, which can affect the brain and the rest of the body. There are several types of sleep apnea, and the most common type is the obstructive sleep apnea, which is when muscles in the back of your throat randomly relaxes throughout the night. This closes or narrows the airway. When your brain notices that you're not getting enough oxygen, it's going to force you to wake up. This causes people to sometimes wake up gasping for air or have that choking sensation, or sometimes can be so mild that you don't notice. This can happen 5 to 30 times or even more an hour throughout the night. And what this eventually leads to is you not being able to reach those deep, restful phases of sleep. There's also central sleep apnea, which is when your brain doesn't send enough signals to the muscles that help you breathe. And then there is complex sleep apnea, which is a combination of both obstructive and central. A recent study by Benjafield and colleagues concluded that almost 1 billion people worldwide have sleep apnea. Countries with the most affected individuals were China, US, India, Brazil, Pakistan, Russia, Nigeria, Germany, France, and Japan. And with the increase in global obesity and with people living longer, researchers are estimating that the numbers of people affected will go up. In the US alone, about 22 million people suffer from moderate to severe sleep apnea, with obesity being the cause of 60% of the cases. How would you know if you have sleep apnea? Well, you experience loud and chronic snoring almost every night, repeated episodes of not being able to breathe in your sleep. This will usually be noticed by someone else. You experience difficulty staying asleep, waking up several times at night to urinate, suddenly waking up and feeling like you are gasping for air or choking, experiencing excessive daytime tiredness no matter how much sleep you got the night before, lack of energy during the day, waking up with sore throat or dry mouth, having headaches in the morning, being unable to concentrate, leading to forgetfulness and memory and learning difficulties, experiencing mood changes such as depression and irritability, having decreased libido and erectile dysfunction. How can you differentiate between regular snoring and sleep apnea snoring? Well, with sleep apnea snoring, the person is waking up feeling unrefreshed no matter how much sleep they got the night before. There are several things that can increase your chances of developing sleep apnea over time. Some of the things are excessive weight or having a thick neck. That's because fat deposits surrounding your upper airway can narrow or obstruct your breathing. Genetics is another thing. So if you've inherited a narrow throat or you have an enlarged tongue or enlarged tonsils, this can also affect your airway. This is the most common cause of sleep apnea in children. Also, men are 2 to 3 times more likely to develop sleep apnea than women, but women who are overweight and going through menopause also have a higher chance of developing sleep apnea compared to women who are not. Sleep apnea tends to be more common in older adults. It can also be a family thing where if you have family members that have it, your chances also increase. Using alcohol, tranquilizers, sedatives, or narcotic pain medications like opioids can cause your throat muscles to relax. This can obstruct your breathing. Smoking is another thing. That's because smoking can increase the inflammation and fluid retention in your upper airways. So smokers are 3 times more likely of developing sleep apnea than non-smokers. Having a history of heart disease, diabetes, or stroke also increases your chances. And then this is another common one, lying down on your back. Many people experience sleep apnea only when they're lying on their back. What can you do to reduce your chances? If you're overweight, lose some weight, exercise more, especially doing stuff like yoga. That helps to strengthen the muscles that help with breathing. Quit smoking, avoid alcohol, sedatives, and all those other drugs before bedtime. Try not to have heavy meals 2 hours before you sleep. Sleep on your side. and have a regular sleep schedule. There are several treatment options available, and your doctor will usually do what's best for you. But the most common treatment for moderate to severe sleep apnea is a CPAP machine, which is a device that delivers air pressure through a mask while you're sleeping. This device can be very uncomfortable. It takes some time to get used to. So please, if you have to use it, be patient. It's not your fault. It happens to everyone who starts off with the machine. If sleep apnea is left untreated, it can have negative long-term consequences to your health, such as heart problems, because the sudden drop in blood oxygen levels can cause your blood pressure to go up. This will now increase your chances of having hypertension, heart attack, stroke, irregular heart rhythms known as arrhythmia, coronary heart disease, and the list goes on. Also, multiple episodes of low blood oxygen can lead to sudden death. Obstructive sleep apnea increases the chances of heart failure by 140%, increases chances of stroke by 60%, and chances of coronary heart disease by 30%. Sleep apnea can also lead to depression, can worsen the symptoms of ADHD. It can lead to liver problems, eye problems like glaucoma, and it can have an overall effect on your day-to-day activity, causing you to have poor performances in school, work, and even increases the chances of getting involved in a motor vehicle accident. Thank you for watching my video. So if you have any questions, comments, or stories you'd like to share, you can leave it below in the comment section, or you can share it with me on Facebook, Twitter, and Instagram. Please don't forget to like, share, subscribe, and see you next time.